All right, so hi everybody, welcome. Thank you so much for coming. Really appreciate you all being here. Just a quick introduction for me. My name is Lynn Tukel. I'm an intern with RCA currently. And for those of you who aren't familiar with the RCA, I just wanted to give a quick introduction for kind of what we are and what we stand for. So the RCA, which is the Right Care Alliance, is a grassroots coalition of clinicians, patients, and community members organizing to make healthcare institutions accountable to communities and put patients, not profits, at the heart of healthcare. Our vision of a transformed system is one in which the pursuit of health is a right and healthcare is based on healing relationships close to home, affordable, effective, and just. We all deserve a system in which health professionals and patients alike experience the care they give and receive as meaningful and necessary. Right care is a human right. It places health and well-being of patients first. Right care is affordable and effective. It is compassionate, honest, and safe. Right care brings healing and comfort to patients and satisfaction to clinicians. Achieving right care will require radically transforming how care is delivered and financed. So with that, that's just kind of a little introduction of who we are. And so yeah, with that, I'll pass it to Dr. Southwick.
Great. Thank you, everybody. We've really got a terrific turnout, and we realize that there's so much misinformation out there that everybody is hungering for the right information, the scientifically based information. So what I'm going to do is I've got some brief content of the updates from what's going on right now, and everybody actually entered or actually gave questions ahead of time. So I've actually incorporated all those questions into this presentation. But if I don't cover something that you want to know about, please share it in the chat, and we will answer those after we cover all of these questions. There were over 120 questions, and I thank Ricky Ashby for actually, and John Hutton for summarizing all of these questions so they were manageable. So let me start. And I want to start people, as was really clear from the responses in the questions, people are very concerned about the spiking cases throughout the United States. And they are unsure when and how they can safely interact with the others. And everybody wants to know, where are we? What is the current situation for COVID-19? Well, unfortunately, I had this image drawn by Bruno Lucchesi about a month and a half ago, and I used it in an editorial in the Gainesville Sun. And unfortunately, it applies now more than ever. And this is a picture of Pandora's jar. And Zeus created Pandora's jar and actually created Pandora, a fair maiden who he knew would be curious and would want to open the jar. And the jar contained all the pestilence of the world and created a giant epidemic. That was over 3,000 years ago, and that is what we're facing today. And unfortunately, the governors of the various states opened too early and therefore actually reopened Pandora's jar, and we are experiencing the consequences of that decision. So here, I've shared this in some of my other presentations. This is a graph showing the number of deaths per day, and this is the number of days. And you'll see the United States is here. There are various countries. Look at South Korea. You can see China. And they're little stars. And these stars are when the particular country chose to lock down. How many deaths did it take? It turns out for South Korea and China, they locked down after only 3 deaths. So their curves, you can see that South Korea really flattened out right away. And China, being a very large country, took a while to lock down, but then they are now experiencing very, very few deaths per day. Now, just look at Italy. Italy is the star at 75. They did not lock down until they had 75 deaths per day and actually experienced a total of 800 deaths. And you can see they experienced an exponential curve, and they were the country with the largest number of deaths until the United States. And you'll see there are no stars for the United States because different states within the United States chose not to lock down. Others locked down briefly, but then after 1 month, they opened back up. And as a consequence, we are now lead the world in the number of cases and the number of deaths. And here is, as of June 30th, this is how we look. We have 2,590,000 cases and 126,000 deaths. And if you look at where they are predominantly, well, New York City, we know, had it early on, but they've really flattened out. They have had, the last time I looked was June 6th, they had 2,000. So they've had a relatively small number. Los Angeles has really taken over as the second largest and is growing very rapidly. Chicago actually hasn't jumped as much. It was at 80,000. And then Miami is moving quite quickly as well. And this is New Orleans is another hotspot, as has been Detroit, although it's flattened out as well. Now, let's look at the curve for the United States. Now, if you look at the curves in Europe, you'll see they went up, but they actually came down, and so they form a mountain. In other words, they were able to reduce the epidemic, reduce the cases, and they're now down at a low level. The United States went up. They started shelter in place or lockdown, but then after only a month, they stopped the lockdown. And so we have experienced a plateau. And then what happened is in Memorial Day, which is approximately here, they opened, everybody decided there was no epidemic. And as a consequence, we now have an exponential curve, and we're up at 40 to 50,000 cases per day. We represent 4% of the world's population, and we have over 25% of the world's COVID-19 cases. Now, here is Florida. And Florida initially had very few. We did shelter in place beginning around April 10th, April 15th, or actually late March. And we got down to a very low level. And our governor started bragging and saying that the epidemiologists were all wrong. We didn't have to worry about Florida. We were great. They began inviting professional baseball teams and other sport teams to come down, that everything was great in Florida. And then May 24th, and he opened up everything very, very quickly. And on Memorial Day, we saw many people at the beaches. They were not using masks and not socially distancing. And as you see, there is now an exponential curve, and we went to an average of maybe 1,000 per day, and now we're peaking. We're up at 10,000 cases per day. And here is Alachua County, where we are. And as you can see, we had very few cases. We were having 4, 5, 2, 3, 1, 1, 1, and then after Memorial Day, the 24th, I took a lag of about 10 days, and then you see, again, an exponential curve, and now we're up to about between 80 and 90 cases per day. So these are exponential curves, a rapid doubling time. And here we talk about an R0 or R sub-0, and that is, on average, if one person is infected, how many people do they infect? And originally, when we started this epidemic, R sub-0 for Florida was 3. In other words, one person on average infected 3 different people. When we completed the shelter in place, April 20th, we got down to about 0.5. It was looking really good, but then we ended shelter in place, and now our R sub-0, it was on May 15th, it was 1.2, and as of June 30th, it's 1.34. So that means that on average, one person infects 1.34. So that means the number of cases will steadily rise. And here was a projection that I shared in late May, showing what would happen if we increased mobility in the state of Florida. And this is the Imperial College. If we stayed shelter in place, there would be very few cases, and this is the number of deaths per day, and there would virtually be no deaths today as of July 6th. If we increased our mobility by 20%, we would experience approximately 30 deaths per day by July 6th. If we increased to 40%, we would experience close to 1,000 deaths per day. Now, we are actually experiencing the large number of cases. Deaths will not be seen for about 3 weeks from now. So I'm very worried that in Florida, we may be experiencing 1,000 deaths per day by mid-July. And a question that's asked is, well, when we shelter in place, will we get the epidemic come back? And yes, it will. And so we need to, what was recommended is we should have sheltered in place for 3 months, not 1 month. And then when everybody came out, what would happen, there would be a mini outbreak, a second wave, then there would be, we'd shelter in place, then a third wave, a fourth wave, a fifth wave. And they will continue to be waves until there is a vaccine. And everybody asks, well, when's the vaccine coming? Well, we hear mutterings that some trials of the vaccines are in phase 3, but realistically, it's still, the prediction is we will not have a vaccine that's distributed throughout the world and throughout our country for at least 18 months. So until that happens, we are going to have waves, and we are going to have to keep in mind that the epidemic is not over. And we cannot assume that everything's back to normal for at least 18 months. So now there were a number of questions related to epidemiology that were sent ahead of time. And one was, what caused the spike of cases in Florida? Well, I think I've explained that. Memorial Day, everybody started gathering together. They weren't using masks. They came within closer than 6 feet. Also, the bars opened. And the bars are closed environments. People are very crowded. They tend not to use masks. They tend to talk. This is like one of the worst environments for spreading the infection. Restaurants, when you eat inside, you are at considerable risk in most restaurants because they tend to be low ceiling with little ventilation. Gyms have opened, and there have been some large gatherings. All of those have led to the rise in the number of cases. Now, how should we interpret the information available to us? Which numbers and statistics should we be looking at? Should we be looking at hospitalizations, deaths, percent test positive, overall cases? And I think what you should be looking at is daily cases, which I graphed before, which is about 10,000 per day in Florida right now. And then look, there was a claim that it's the reason that we have so many cases because we've been testing more. Well, this is from Johns Hopkins. Here is the website. It looks at the amount of testing and the percent positive. Now, this is Florida. In May 24th, we actually did 55,000 tests. The percent positive at that point was about 2%. We had very few cases. Well, we've repeated that number. Here we are up at 67,000. And what's happened is the percent positive has gone up. So you want to look at the number of tests and the percent positive. We are up at 16%. That tells you if you've got a higher percent positive, you're doing the same number of tests. Obviously, there are more cases. This is not due to increased testing. This is due to increased number of cases. Now, you also can look at deaths, and I showed you a graph of that, but that will be a month delayed from when the actual epidemic increased. Hospitalizations will take 2 to 3 weeks after the onset of actual cases, symptomatic cases. And you can also use ICU bed occupancy. These are delayed measures and probably are not effective for really monitoring. So I recommend daily cases and the percent positive tests as the most helpful things to follow in this epidemic. Now, how long will this last? How should we plan our future, going back to work, vacations? And someone asked, what about Christmas? I think the epidemic will still be with us. We must assume. I'm going to give you 5 things that we all need to do. And I'm afraid until we get the vaccine, we are going to have to practice all of these. And I'll go over why that is a little bit later. Will spikes like this continue until the vaccine is developed? The answer is clearly yes. What are the long-term consequences of COVID-19, specifically communities of color? This is a grave concern. And the Right Care Alliance is very concerned and wants there to be equity in healthcare and that everybody receive the same healthcare. And until that happens, communities of color are going to suffer increased numbers of cases and are going to fill our hospitals with these sick individuals. This is a travesty. And I think this is one of the reasons why there have been all the demonstrations in the streets, in addition to George Floyd and others who have suffered at the hands of the police. So we call, the Right Care Alliance calls for an improved access to everyone. Healthcare should be a right, and everyone should receive the same care. So in a democracy, how can we achieve China's success? Remember, I showed that China has virtually no cases. So how can we do that? Well, we all need to lead. We all need to communicate the facts. We all need to know the science and take responsibility to understand the science. The problem has been disinformation. There are talk shows out there. There are websites out there. There are Facebook sites. There are Twitter accounts that are suggesting things that are absolutely not true. For instance, the COVID-19 epidemic is a hoax. This is no different than influenza. Absolutely categorically not true. It is twice as infectious as influenza, and it is 5 to 25 times more deadly. And there are multiple studies now indicating that that is the case. The experts love to lie to us. This is a travesty. This is a tragedy. That means that people are not going to listen to the scientists. And when they do that, they are endangering themselves, because I think of good information as a protective bubble that prevents you from becoming infected. And when these individuals puncture that bubble and you ignore the true facts, you are in increased risk for contracting the virus. And that is partly responsible for the large epidemic, the surge in the epidemic that we're experiencing right now. So there's an epidemic in disinformation as well as an epidemic in COVID-19 infections. Now, what can we do besides wear masks and maintain 6-foot distances and washing hands? This was a prominent question. Well, there are actually 5 things that we need to do. Face masks are a very, very important component. Avoid closed spaces, public spaces. Physically distance. Avoid large crowds. And hand hygiene and other hygiene. So let me go over each one of those. So what's the science between why we should wear masks? Should we wear masks? Absolutely, that's number 1. We should always wear masks in all closed public spaces and most open public spaces if we think someone is going to come close to us. If we're out alone and we're way over 6 feet, such as exercising, you probably do not need to wear a mask during that time. However, you should have it handy and wear it if anybody comes close to you. Now, what is the science behind why we need to wear masks? And this is from the New England Journal. It's a laser light study. Individual was put in a little box where there are green laser lights, and you'll see the droplets of a person speaking, and then you're going to see what happens when someone wears a mask. First, without a mask. Watch what happens. The droplets coming from the mouth will look like green dots.
Stay healthy.
Great.
Stay healthy.
Great. Less loud.
Stay healthy.
Good.
Now with the mask.
Are you recording?
Yeah.
Stay healthy.
Louder.
Stay healthy.
Louder.
Stay healthy.
Nothing.
So I think this proves beyond a shadow of a doubt that a face mask will prevent droplets from reaching those that are around you. As we mentioned, the R naught or R sub zero is somewhere between 2 and 2.7. Right now in Florida, it's at 1.34 and climbing. And we know that 10% of all close contacts in families particularly will contract the infection. And if you're in a closed space with other individuals, you are at risk. But however, if everyone, and if that is, if 80% of individuals wore masks, we could drop the R sub 0 below 1. That means one person would infect less than 1, and therefore the epidemic would resolve. Goldman Sachs released a study today. Increased mask use by 15% would reduce economic losses by $1 trillion. Because we would not have to re-shelter in place. We could continue our businesses, but only if people do wear face masks. So this is not just about an individual right. This is about saving our economy and saving lives. It's a no-brainer. Now, I've looked into masks, and I actually, early on, I went to the CDC website and I sewed my own cloth mask. And here is that example. And there's a pocket in many of the cloth masks where you can put paper towels or coffee filters. I also purchased masks from South Korea, and they like to do funny masks. And then I've also purchased cloth masks from China, and also Amazon Marketplace. This mask actually came from Orange Park, handmade. And then Publix has disposable surgical masks. And actually, as far as breathing easily, the disposable surgical masks actually are the most comfortable when having tested all of them, and those can be purchased at Publix. So what does it mean to wear a mask? I wear a mask to protect you, and you protect the mask to protect me. So this is actually shows that you care about your fellow man. So when someone walks into an environment without a mask, they're saying, I don't care about you. I don't want to wear a mask. That's my personal right. I would ask you, is it that individual's personal right to infect you, to expose you potentially to COVID-19? I wonder. So how can we persuade our community members to wear masks? Well, that's why I'm presenting today. And I think you have to share the science, and you also have to encourage community mindedness, caring about your fellow man. And I think Americans do. And somehow when it comes to personal rights, they get their hackles up and they ignore the needs of their community. A question was asked, should children wear masks, and how young? This is really not known at this point. I'll show you a little bit later that most children have very low level infections, and there's been little evidence that those under age 10 actually are spreading the infection at all. But we'll talk a little bit later about that again. In addition to face masks, face shields actually are quite effective. And when you were to cough, it would block straight ahead. Now, one problem is fluid droplets could come from the side. So if you were standing to the side of, this is my wife, Kathy, you might, if she sneezed, you might get some droplets. But I think that this is quite effective, and you can see people's expression. Now here is an N95 mask. This is a very tight mask that fits closely in the face. Very fine particles cannot get through this mask. And this is what we use in the hospital when there is aerosol. And generally in public, we do not need an N95 mask. That's really overkill. Now, the second important thing is to avoid closed spaces. And I don't think everybody appreciates this. And going from yellow to green, obviously yellow is worse, green is better. Our small room with little ventilation is very dangerous. If you're in there with someone that happens to be carrying the virus, you can become infected. Larger rooms with higher ceilings, larger volume, less risk, but still somewhat risky. Safest is outdoors. And in addition to space, the airflow within that space is very important. A small office with little ventilation, very dangerous. Restaurants with low ceilings and very little windows and not very much ventilation, they are quite dangerous. Larger restaurants with higher ceilings, more ventilation are safer, large grocery stores with restricted capacity are relatively safe, but outdoors is the safest because obviously the airflow is the best. And in buildings, if you can control the ventilation, the ventilation they should be drawn from the outside so that you continually renew that room with fresh air. And the more frequently the turnover, the better. Most places turnover in 1 to 3 hours, and it'd be nicer if it was faster. Now, another key element is how long you were in close contact with somebody. It turns out that the magic number seems to be over 10 minutes. If you're in close contact with somebody in a closed environment for greater than 10 minutes and they test positive, then you should worry. You are a close contact. You need to be quarantined and you may need to be tested. Now, someone asked, what about the protests? Well, they were outside, but the problem is there was overcrowding. There was not physical distancing 6 feet. There was inconsistent wearing of masks. There was yelling, and as you saw in that video, yelling increases the droplets and extends them further. It was crowded. It was over 50 people. So, and they were together for long periods of time. So I suspect that there are going to be cases as a consequence of these protests. Now, I think if you did protest responsibly, that is, wore masks, stayed 6 feet away from others, you can protest and still be relatively safe in the outside. What this emphasizes, I think, is that there's no place like home. So whenever possible, stay home. Only go out for very necessary things. Now, third, maintain 6 foot physical distancing. And why is that 6 feet the magic number? Well, as you saw when you talk, there are droplets released. When you cough, they are released, and the droplets tend to be heavy, and they tend to drop before 6 feet at about 1.5 meters if you cough. If you sneeze, they can be projected even further, and therefore 6 feet is not foolproof, is not an assurance that you won't be exposed, and that's why we recommend masks in public places. Now, I also point out these little aerosols that can be gross in some people, and those that sing, they produce aerosol. These are droplets of less than 10 microns. They will stay in the air for up to 3 hours and float around like a gas. Someone can come by and inhale those, and they are so small they will go right into the bronchi and into the lungs, causing lung infection right away, and they're very dangerous. Now, why are we so worried about all this? Well, it turns out that 40 to 60% of patients who are infected with COVID-19 they should be asymptomatic, or pre-symptomatic. That is, they don't know they have the infection. So you can be wandering around, feel perfectly fine, and you could have the infection or about to get symptoms, and that happens to be the time that you are most infectious. So if you're not wearing a mask, you are endangering others. And 6 feet is usually 2 arm lengths is a good judge as far as keeping your distance and flattening the curve. Avoid crowds. Now, a crowd in general, if it's intermediate risk area of the country or a red zone where there is a high, right now most of Florida is red zone. Certainly all of southern Florida is a red zone. So you would not want gatherings of over 10. And an intermediate zone, which is usually about somewhere between 2 and 7 per 100,000, no gatherings of greater than 50. Remember, if there's, the more people there are, the more likelihood there's someone in the crowd that's asymptomatic, or perhaps somebody that's a rapid spreader, a super spreader. And these patients, we don't know why they are super spreaders, but they do exist. And then finally, practice good hygiene. That is, wash your hands, clean surfaces. And there were a lot of questions about this. Can the virus be transmitted from the bottom of your shoes? Highly unlikely. How long does the virus survive in surfaces? Well, it can survive on a hard surface for up to 3 days. However, that was really emphasized at the beginning. But when we look at the epidemiology, where the cases have cropped up, we can find virtually no cases where someone touched the surface, then touched their face. So this is a very rare way of spreading. And carpet, it's very hard to pick it up. Cloth, very hard to pick it up. It's really hard surfaces where theoretically it could happen if you touch a very contaminated surface. If someone coughed really densely on a surface, you took your hand and spread it on and then put it on your face and eyes, it might happen, but it's highly unlikely. I do not recommend cleaning off every package when it comes in. It may make you feel better, but it's probably not a benefit. And then is there a medicine, vitamins, or supplements to prevent this virus? The answer is no. And the hydroxychloroquine was thought, there is a study now that proves that it cannot prevent the infection. There's nothing we know of, any medication that can prevent this infection. Now, there have been a lot of questions about church services. And I want to share this case from South Korea megachurch. And there was one super spreader who actually came from the Hunan province in China, where the epidemic started. And she attended this megachurch twice, and she infected 1,160 people. And there are several massive outbreaks in churches in Europe as well. So large gatherings, such as churches, are extremely dangerous. We really need to avoid them. And I feel badly that I have to tell you that. But religious services, is it safe to have a church in person at this time? The answer is no. What are the challenges specific to worshiping indoors? I've just described them. If it's a smaller church, you're at high risk. A large church with a lot of ventilation, it's possible that it's somewhat safer, but then there are activities. You will not be able to greet people. You will have to stay 6 feet away. Is that a satisfying service? Is a virtual service actually better than having to distance each other from 6 feet and being worried that you may contract it from a super spreader? How large should groups be? I think right now, I wouldn't recommend even those under 50, because we're actually at a very steep curve, even in Alachua County. Is singing possible? No, it's not at all. It produces aerosol. The only way I could recommend having singers is they would need to be tested periodically to ensure that they're negative, because they're going to produce aerosol, and that aerosol could float over to the audience, and people could become infected, and you could have a giant outbreak. If you're not opening worship now, when should we? It's all going to depend on whether people are willing to use masks, whether they're willing to avoid crowded spaces, if they're willing to distance themselves. If we don't adhere to this and we feel that we're invulnerable, this could go on until the vaccine. How could it be done? Gather outside. I think as the weather cools down in the fall, I think this is a big possibility. If people stayed 6 feet apart, wore masks outside, I think that would be relatively safe. But it will depend on the prevalence of infection and the rate of infection at that time. So I don't have a crystal ball as to how people will behave and whether or not whether the epidemic will have quieted down. Would sharing microphones increase transmission? Probably minimally. If two people share a microphone, theoretically it could become contaminated. But again, I don't think that contamination of surfaces is going to be a big component. When worship services resume, what precautions have to be taken? All of the 5 things that I described will need to be taken. What should church staff be considering when trying to make services safe? All the things that we've already described. And there will be specific things to churches, and each group, what will have to happen, and I know has happened, is you'll have to have a committee to sort out your individual church and whether or not it's big enough and whether it has enough ventilation, whether you can space people to decide how many and who should come. And one of the problems is younger individuals tend to be asymptomatic, and older individuals are far greater risk for dying. I didn't describe this in previous presentations. If you're 60 to 69, if you get the COVID-19, you have about a 4% chance of dying. If you're 70 to 79, you have an 8% chance of dying. If you're over 80, you have a 15 to 25% chance of dying. And therefore, it'd really be scary for those at these older ages to come into a closed environment where they're at risk of contracting the infection. And I think no church wants to see their elders infected in the church and then die. What about children? What do we know about the transmission of children to adults? Should children wear masks? At what age? What do you think about children going back to school in the fall? What about daycare? Well, the big good news is that we know that the number of ACE receptors, and that's the receptor in the human respiratory lining that the COVID-19 or the SARS-CoV-2 virus binds to. When you're younger, you have fewer receptors. You actually get a much milder infection. And that means that also you don't have as high concentrations in the sputum, in the saliva. And so far, there really have been very few cases spread by children. So that means I think daycare is fairly safe. Younger kids going back to school, we don't know about middle and high school. They're more likely to have higher numbers of ACE2 receptors, get somewhat more severe disease. It's really the risk of the teachers and the age of the teachers what we have to worry about as far as the schools go. But I think this can be considered under the appropriate guidance. And I know we'll talk a little bit more about University of Florida in a little bit. So clinical presentation and treatment. Are there multiple forms of virus, and does the same virus present differently in different people? There seem to be some small mutations. Their impact on spread and virulence, and that is severity of disease, are not known. In general, severity relates to whether or not you have an underlying disease, such as cardiovascular disease, diabetes, chronic lung disease, or hypertension, or if you've had cancer recently and undergone chemotherapy and immune compromise. Those individuals tend to get more severe disease and tend to have a higher mortality. As we already mentioned, those that are older tend to have a higher mortality. The other big thing I'm quite sure we don't have absolute evidence, but is that if you get a higher dose of the virus, you inhale a large aerosol or a large amount of droplets because you weren't wearing a mask and the other person wasn't wearing a mask, you will get more severe disease. And we have seen that in healthcare providers that were working with respiratory equipment and breathed in the aerosol. They have had very severe disease, requiring intubation and almost dying. How does blood type impact getting the virus and severity of symptoms? There is new genetic data just 2 days ago that group O blood type is associated with lower risk of acquiring COVID-19 and non-O groups, and A group is associated with a higher risk than non-A blood groups. So if you're group A, you are at higher risk of contracting the infection. If you're group O, you have a lower risk. What does informed consent look like for COVID-19? Well, we have two experimental protocols ongoing at the present time. Remdesivir, which is an antiviral that actually blocks the RNA replication of the virus and shuts the virus down. We have a very careful informed consent approved by our RB and by the FDA in order to give that drug, and by the NIH. And similarly, there is the FDA has approved a consent for convalescent plasma obtained from individuals that were infected about 20 days earlier, 28 days, that are documented to have high antibody levels. It turns out that there is significant benefit to convalescent plasma. So, and I've actually just treated 3 patients with remdesivir. In each case, within 48 hours, their lymphocyte counts dramatically improved and their symptoms improved. So remdesivir is looking efficacious. I've also used convalescent plasma, and in the 2 cases I used it in, it dramatically improved clinical response. They improved clinically, and it's been shown that it does decrease and eliminate the virus from the blood fairly quickly in many, many cases. So those are benefit. The third drug that we're looking at now is the steroid dexamethasone, and that reduces mortality and is being used as well. That does not require informed consent, but a verbal, because dexamethasone has been used for years, and in general, it is not harmful, but it has the potential to be helpful. Now, what about testing? How often we should get tested? If you have no symptoms and you have not come in close contact with anybody that is infected, do not waste the time of being infected, being tested, because even though this test, the PCR, is highly accurate, it's like 99.5. If the pre-test probability is very low, and in our county, we've actually done testing. I just heard this at UF Shands, UF Health. We're at 0.8% prevalence of positive tests. Well, it turns out when you get down to that pretest probability, the likelihood of a false positive is somewhere about 1 in 4, and a true positive is 3 in 4. So you have a risk of getting a false positive. It's not cost effective to do a test. If you have symptoms, if you have fever, if you came in contact, then you should get tested. And I don't recommend repeating testing unless you're going to sing in a choir, which we're not doing right now, or you perhaps a healthcare provider at high risk. Were you doing that in the elderly in nursing homes? What is the benefit of antibody testing? Right now, there is no benefit to the individual. It is strictly at this point an epidemiologic tool to determine the prevalence, how much disease is out there. And we have found in certain areas, it's higher than we had predicted, as high as 20%. In most areas, it's still about 2%. If someone you know is tested positive, what should you do? Then you want to quarantine. You want to stay with others, quarantine for 14 days. If you want, and you should not get tested for at least 5 to 7 days after you were exposed, because it takes that long for the PCR. You have enough virus for the PCR to be positive. If you're going to you need to go back to work, then test. Otherwise, you quarantine yourself for 14 days. If you have no symptoms after 14 days, you're okay. Are temperature checks helpful? If so, when they should be done? Yes, I think temperature checks are an undervalued and underused method. When I look at the way this virus invades the host cells, it dramatically increases the production of inflammatory cytokines. Therefore, there's every reason to believe that every patient is infected, and the CDC says it's anywhere from 90% to 99.5% have a fever at some time. So if you were to take your temperature all the time, it is likely you would pick up a fever. If you have a fever, then your pretest probability of COVID-19 is higher, and you should get a PCR test. And I recommend, and I don't have any stock or any conflict of interest here, this electronic thermometer by Kinsa interacts with your smartphone. And if you develop, and you put it under your tongue, and it takes the temperature within 1 to 2 seconds, and then it sends this to the smartphone through Bluetooth. Then you answer a series of questions, such as, do you have a cough? Do you have fatigue? Do you feel short of breath? And if certain questions are answered positive and you have a fever, you will get a red hand saying you stay home. If you don't have a fever, if you don't have those symptoms, you get a green hand and you can go to work and you can go to school. And I think this is a very useful and is a way that we could really prevent those with potential to have early symptomatic disease be identified and not go into public spaces and not go back to work and not go to schools. Now, public policy. What are the public policy measures should be taken to reduce this current spike and bring us closer to safe reopening? Right now, the Pandora's jar is wide open. We cannot really screen, test, and protect right now. Think about it. If there are, just think about in Alachua County, there were 90 cases on Saturday. That means each individual on average has 20 to 50 contacts. So you multiply, so it's somewhere between 500 and 1,000 contacts for 90 people. I mean, that's just impossible. You cannot do tracing under that circumstance. So we have to get the numbers down to manageable. If you have 10 cases, then you can contact trace, and then you screen, you test, and then you isolate those that are positive. That we can do. So it should be closed down bars. Absolutely, they should have never been opened. Should we close down restaurants? I am afraid at this point we're back to as steep as we were before. We probably need to close our restaurants. We probably need to re-shelter in place. I don't know if the government will do that because it was so unpopular. But when we reopen, we have to train everybody to follow those 5 things. So it's really important. We are only as good as our weakest link. Now here's the link for UF Health. They have a very nice video showing what we're planning to do. And UF right now, as of today, is planning to open in the end of August. And if we can screen, if we can test, we hope that we will be able to actually keep the epidemic under control in the university. Unfortunately, I have to tell you that I had a case where a mother of a senior in high school at Gainesville was staying at home, and the mom said, "You can go out a little with your friends." Well, she went out a little, and she met up with a University of Florida student who was an asymptomatic carrier. She came home, she gave it to her mother. Her mother is in the hospital right now, quite sick, but fortunately we had remdesivir and she's getting better. But that shows how the university can spread to our environment. So I think armed with all this information, if you follow the rules and you can convince others and share these scientific facts, we can make a difference. So, and then I wanted to point out, there are websites that we will share. I actually have an entire course on COVID-19 through Coursera that is free. And here are the sites for the Right Care Alliance. And we hope you will consider joining us. So with that, I will stop sharing, and we have 10 minutes for additional questions. Although I hope I answered all of the 120 questions that were proposed. So, John, do we have additional questions, comments, thoughts?
The first one we can start with is, where can we find this PowerPoint and this video?
Actually, someone's recording the video. Do you record it, John?
No, Ricky's recording it. I guess I can answer that question. Good. We'll have this posted either through email, or we'll have a location where you can access the full video. And I can definitely share the PDF file of this, no problem. And the last town hall that we did is also able to be accessed through video. You can find it in the RSVP link. And that had even more information on COVID-19. So one question could be, for temperature checks, you talked about that as a way to monitor testing. What about temperature checks at the door of a business or a church? It's really not that effective because it's one time point. What I maintain, and I would like to get a group of asymptomatic carriers to do this, but we haven't gotten it yet. You need to check the temperature twice a day. Then do it the same time every day, and put the thermometer under your tongue at the same place under your tongue each day. And what I found for myself, my set point happens to be 97.8. So if I go if I go 2 degrees centigrade above 97.8, if I was 2 degrees, then I would be actually 99.8, wouldn't I? By definition, which our definition for fever, taking all comers, is 100.4. I would not have a fever.
but for me, that would be a fever. You see, that would be that suggest that you may have COVID-19. So if each of us followed our temperature every day, particularly during this outbreak, and did this before work, we would not come to work if our temperature went 2 degrees above our normal baseline. Now, one point, it turns out that there is a little diurnal variation. Your temperature is highest usually in the early evening, and it's lower in the morning. So if you come to work in the morning and you're at 99, you'll look fine. At 4 o'clock in the afternoon, you may be 101. And they've seen in I've talked to a lot of companies, and what happens, they screen at the door, you're afebrile, you're at work about 3 o'clock, you start to get febrile, you get symptoms, and meanwhile, you've spread the virus to people for about 8 to 10 hours. So I think we do it. I wouldn't say don't do it, but it's not particularly effective.
Right, because you need a baseline reading.
Right,
Okay.
and you need to follow your fever curve or your temperature curve for a prolonged period of time to get a feel for it.
Okay. We talked about children, but we had a question about pregnant women. Are there any concerns specifically for them? Are they more at risk?
It turns out that there have been some cases now that it can be more severe. So I think pregnant women need to be careful. Originally, it was said that they contracted at the same rate as others. It was said that they weren't in any more danger, but recent studies suggest that actually they are. The good news, it does not cross the placenta, so we will not get into the fetus. It does not infect the fetus.
Okay. And then that's another question we could talk about. We've seen information change since the beginning of the pandemic to now. What is the cause of this shifting information?
Because this is a new virus. It came out of nowhere. No one has seen a virus like this. I personally, in my career, have never seen a virus like this. I've never seen one that could cause such variation in the severity of disease from no symptoms to close to death within a day or two. And the second thing, I've never seen a virus with this that caused this severe disease that is so infectious. And we still don't understand exactly how it's spreading. Initially, we didn't think they were asymptomatic. The Chinese said they weren't asymptomatic. We know beyond a shadow of a doubt now that 40 to 60% are pre-symptomatic or asymptomatic. So that changed the rules. We initially thought, well, we didn't need face masks because it couldn't be that infectious. Now we know it's extremely infectious, and if you're talking to somebody, you can spread it. We thought, oh, you have to cough. Nope. You just talk to somebody. You say, hi, John, and if I'm asymptomatic carrier, you're infected. Thank you very much. Because you didn't wear a mask. I gave it to you. Thank you. So the rules have changed. And one of the things, somehow, when we get new information, oh, they were lying to us before. That was the information we had at the time. It does change. That's the nature of science. And so we're always looking. We're always asking questions. We're always retesting our hypothesis. And if the hypothesis that we had originally, the hypothesis was you had to be symptomatic to spread it. That turned out not to be true. We found many people that didn't have symptoms. We looked at the epidemic curves. They did spread it. So we changed our rules. That's the nature of science. We're always changing. We're always adjusting. We're always learning. And that doesn't mean we're lying. It means we're learning. And we're sharing that knowledge with you. And we want to give you the current information so that, because that information allows you to make judgments and allows you to everyone to save lives.
Okay, thank you. I thought that was an important point
Yes.
to clarify.
And another one that's a big deal. Oh, these people, they forecast these ridiculous forecasts. They're calling for all these deaths. This is ridiculous. Well, the original forecast did forecast for a lot of deaths, and then scared all the governors, so they sheltered in place. So it didn't happen. And they say, well, the forecast exaggerated. No, what happened is that forced everybody to do the right thing, so we didn't end up with that forecast. And do you discount the weatherman if they don't get the forecast right every time? Do you therefore don't listen to the weather forecast anymore? I think that is very dangerous. For instance, I was going to go back and attend on medicine July 15th. Well, in late May, the Imperial College came out with that prediction that forecast about Florida was going to heat up by early July, and there would be a big outbreak that would be worse than the original one. And so I called my boss and said, hey, this was in May. I'm not going to be able to attend in July. I know there's going to be a big outbreak. Well, guess what? It's happened. And there was actually yesterday, our governor said 3 weeks ago, those forecasters that exaggerate everything. They said Florida was going to heat up like New York City. That was just wrong. Guess what? They were right. We are now becoming like New York City. What the timing wasn't exact, but the lesson to be learned is listen to the experts. And governors and politicians, you are not physicians, you are not scientists, you weren't trained in that. You need to listen to the experts. And until you do that, Pandora's jar is going to remain open, and we are all in danger. And we should be angry. We should be angry at those politicians that are not listening to the scientists. We need to stand up and say enough is enough. And I can tell you physicians are starting to stand up because we are paying the price. We are now caring for these patients. Some of us are dying because we are exposed as we care for patients, and we are suffering as well. And we have to watch as individuals die in our ICUs. This is a tragedy. It should not be happening. Shame on you, politicians. Shame on you.
Thank you, Dr. Southwick. Thank you.
Sorry to get emotional, but I'm actually dealing with these cases.
Yeah, and it's very important to hear from professionals and experts on these issues. So thank you for sharing your voice. It's about 6 o'clock. We could have a couple more questions, if that's okay.
Sure. Yeah, we can go 2 or 3 more.
Okay. So this is a question on the severity of infection, and how severe the infection is, does that impact how the immune response is, and how the immunity is after the fact? So would an asymptomatic person have less immunity than a person who had a severe infection?
That's an excellent question, and that's true. We know that a mild case, an asymptomatic case, the antibody titers are lower. Those that have severe disease tend to have much higher antibody titers. And the titer probably does relate to the degree of protection, but we're still evolving those studies right now.
Okay.
But I think that is the case. That's going to be the case. And so a higher titer. One of the problems is when you do an antibody test now, you don't get a titer. It's yes or no. What you really wanted in most antibody experiences are 1 to 160. In other words, you have to dilute your serum out to 1 to 160 before the ELISA goes negative. Then you can't detect. That's a protective level. Below that is probably not that protective. The higher the titer, the higher the protective level in general.
So for someone who already had the infection, I think we talked about this at the last town hall, but how safe is someone who's already been infected? How immune are they?
We can't know. One of the problems is young people have a really very vigorous immune response. People over 60 are known to not have as vigorous immunoglobulin response. Their immune system is wearing out. And that's one of the reasons why they suffer so much more from this virus, which really counts on your immune system becoming active, but not too active. The other problem is it can overreact, and that is a big problem too. And that's why those that overreact, we're using dexamethasone, the steroid, to block that overreaction.
Okay. At 6 o'clock, I think that'd be a good place to stop. And I just wanted to say that there was a lot of support for you, and thankful people were thankful to you in the chat for your words on this subject. So
yeah, and what we're going to do, we've decided we're going to do a town hall meeting every 2 weeks, pretty much regularly. It'll either be Mondays or Wednesdays. We may do one for work people on a Monday so that we can get some of the restaurant owners so they can learn about how to protect everybody. But there's so much that everybody needs to know, and there will be continued questions. And the key to learning is repetition. Great.
Yep.
Thank you. It's a pleasure.
Okay. Thank you, everybody. And this can be this will be able to be found on the Facebook page in the future. So thank you, everyone, for joining us.